will discuss the introduction of our commentary video. In the first seminar, the topic discussed was the impact of social media and its influencer. The guest speaker, Rainier S. Ladik, a registered psychologist, began the seminar by discussing both positive and negative impacts of social media on our lives. One of the negative impacts he mentioned was vicarious trauma, which occur when we unintentionally come across violent or distressing content on social media. The speaker also emphasized the significance of choosing appropriate content and influencer on social media. He discussed practical self-help techniques and professional psychological strategies to help deal with the negative effects of social media. The second seminar, we received training on the psychological intervention and were introduced to our guest speaker, Mr. Javin Manyas. He emphasized the importance of ethical considerations when providing psychological first aid and providing us with clear understanding of the do's and don'ts in this regard. He also discussed the appropriate situation and context where psychological first aid should be provided, as well as vicarious purposes of offering psychological support. Lastly, our third seminar on mental health crisis intervention, Abot Kamay, Bigay Gabay, with Dr. Nicanor Chavez as a guest speaker. We talk about the Mental Health Act or RA 1136. Dr. Chavez emphasized the significance of practicing mindful living, cultivating a positive attitude, adopting a healthy lifestyle, and being mindful of medication and maintaining good mental health.
Social media is now a vital component of our lives in today's fast-paced society. We communicate with our friends and family through it, share our own experiences, and look for anyone's approval. Teenagers, though, may find this to be a double-edged sword. Even though social media can be a platform for self-expression, it can also lead to pressure to live up to unattainable expectations, which can result in anxiety, despair, and other mental health problems. As we go further into this subject, we will look at how social media affects teenagers and what we can do to protect their mental health. We will talk about how crucial it is to establish clear limits, encourage healthy behaviors, and foster open communications. It's crucial to keep in our minds that it is our duty as an adults to help and mentor our children at this delicate time.
In this seminar too, magre-recap lang ako ng onte sa mga nabanggit ng ating guest speaker, which is the mental health, psychosocial support, and the psychosocial first aid. Nagbigay rin si Sir ng quote, which is in his intro is, "Life doesn't make any sense without interdependence. We need each other, and the sooner we learn that, that is better for us." Tapos yun, nagtanong si Sir ng mga onting katanungan kung nakatulong ka na ba sa mga naapektuhan ng mga disaster, and kung ano yung mga suportong ginawa mo, ano ba yung mga pumapasok sa isip mo kapag naisip mo yung mental health and psychosocial support. Sino ba ang mga nagbibigay ng ganitong suporta, kailan at saan? So sisimulan ko na. Nagbibigay lang ako ng onting kaalaman tungkol sa mental health, which is mental health is a mental state is a which is a person is aware of their own abilities, can handle life's typical stress, work productively and fruitfully, and make a difference in their community. Next is the psychosocial support. Refers to actions that provides immediate relief suffering both emotional and physical. Improves people's short-term and functioning and reduce long-term negative psychosocial effects. Ang galing ito sa IASC guidelines on mental health and psychosocial support in emergency settings noong 2007. Magbibigay rin ako ng kaalaman tungkol sa psychosocial first aid. PFA is a humane and supportive response to a fellow human being who is suffering and who may need support. It is an acute intervention of choice when responding to the psychosocial needs of children, adults, and families affected by disaster and pandemic. Sa field ng neuroscience and psychology, there are connections between mental health, psychosocial support, and psychosocial first aid. Na understanding the intricate operations of the human brain and how it affects our actions, emotions, and thoughts. Requires an understanding of these subjects. Ito yung mga subjects na i-connect natin dito sa ating seminar ng ating topic for these midterms. Naka-include dito ang action potential, synapses, neurons, neurotransmitters, psychoactive drugs, and vision. Unting recap lang din, neurons communicate with each other through action potentials. Neurons are especially nerve cells that communicate by sending electrical and chemical signals. Neuron's action potential is an electrical signal that travels down its axon and triggers the release of neurotransmitters. These neurotransmitters, which are chemicals that aid in information transmission between neurons, are crucial for maintaining mental health. Ito yung mga nakakulit dito, which is depression is one of the most common mental health conditions. Neurotransmitters like serotonin, dopamine, and norepinephrine and frequently deficient in depression. When there is a shortage of these neurotransmitters, it can cause feelings of melancholy and hopelessness because they are in charge of controlling mood. Antidepressant and other psychoactive medications can help to elevate the levels of these neurotransmitters, which can elevate mood and lessen depressive symptoms. Ang individual's emotion and social needs naman are ang mga main focus ng psychosocial support. A type of therapy by giving people the resources they need to handle stress, overcome obstacles, and forge healthy relationships. Psychosocial support can aid in the improvement of mental health. For people who have gone through trauma or other major life events, this kind of support can be especially helpful. And visual hallucinations can be caused by psychoactive substances like hallucinogens, and that after perception, visual cortex neurons in the brain are active during vision, which is the process by which we perceive the environment around us. Understanding the functioning of the brain and how it processes the visual information can be gained by the using psychoactive substances by that change perception. And lastly, people who have been through a traumatic event can receive immediate support in the form of psychosocial first aid. Long-term mental health conditions like post-traumatic stress disorder, PTSD, can be avoided with the aid of this kind of support. Aspects of psychosocial first aid including listening, offering emotional support, and connecting people with services like counseling and support groups.
Mental health crisis intervention. Abot kamay, bigay gabay. Learning something new regarding how to intervene in a person's mental health helps a lot. Being mindful of what a person feels. There are a lot of ways to approach someone going through difficulties, and I learned that having a mindful, positive attitude will help me approach easily and will gain the person's trust better. The seminar talked about mindful healthy lifestyle. The seminar tackled topics regarding what are the causes of disorders, stress response, and signs and symptoms. The seminar talked about the plans for this year by the government, such as building infrastructures for readily available psychiatric emergencies and crisis intervention, psychological testing center, and MH medicine access program. The seminar also talked about how every local government, unit, and academic institution will create their own mental health programs in accordance with the general guidelines set by the Philippine Council for Mental Health. And the last thing the seminar tackled is regarding establishing a national mental health policy for the purpose of enhancing the delivery of integrated mental health policies and protecting the rights of persons utilizing the mental health services. Action potentials and sicknesses play an important role in mental health crisis intervention. Mental health crisis can be caused by a variety of factors such as traumatic experience, genetic predispositions, or chemical imbalances in the brain. When someone experiences a mental health crisis, the neurons in their brain may become hyperactive, leading to increased firing of action potentials and overstimulation of synapses. This can result in symptoms such as anxiety, panic attacks, and disordered thinking. Crisis intervention techniques such as cognitive behavioral therapy or CBT and medication management aim to regulate the firing of action potentials and modulate the strength of synapses to reduce symptoms and restore healthy brain function. For example, medication that affects the activity of neurotransmitters such as serotonin or dopamine can help to balance the chemical signaling in the brain and reduce symptoms of depression or anxiety.
In conclusion, during adolescence, the brain is more plastic and so more easily shaped by experiences than other times in our lives. Also, brain circuits that are no longer used are eliminated, so it appears to be the best chance in life to learn new skills and develop long life habits. Of course, learning new skills and developing old ones is possible throughout our lives, but this becomes more difficult in adulthood. Mental health and brain injury are separate conditions, but this does not mean that a person cannot be affected by both. It is important to make sure that you are accessing the right kind of support depending on the diagnosis given. And it is hoped that the information in this fact sheet has helped to clarify where that support can be sought from. Increased use of social media among young people in recent years has caused some mental health challenges, including increased levels of anxiety, depression, and low esteem. People get used to it and start using it timelessly, irrespective of the pennyworths built up with them. This may even lead to improper sleep, mental issues, or mental stress, killing time, and other health issues. These are all harmful psychological effects of social media on youth. However, multiple studies have found a strong link between heavy social media and an increased risk of depression, anxiety, loneliness, self-harm, and even suicidal thoughts. Social media may promote negative experiences such as inadequacy about your life or your appearance. Everyone experiences personal crises. Crises are acute, time-limited events experienced as overwhelming emotional reactions to one's perception of an event. Crises are experienced by people of all ages, culture, socioeconomic conditions, and may or may not be related to a specific mental disorder. Awit Kamay is about accessibility. Common issues include depression, anxiety, anger, cognitive or the thinking issues, and problems with regulating behavior. These issues can either develop because of damage to the areas of the brain that are responsible for managing emotions or as a result of struggling to do things that you once did. Overall, the goals of crisis resolutions are to prevent violence in the short term and in the long term, to assist the patient's return to normal cognitive, emotional, and behavioral functioning and avoid crisis recurrence. Being both physically and emotionally fit is the key to success in all aspects of life. People should be aware of the consequences of mental illness and must give utmost importance to keeping the mind healthy like the way the physical body is kept healthy. Mental and physical health cannot be separated from each other.